Welcome back to another episode of Christian Natural Health. Today, I'm so pleased to have Dr. Connie McReynolds with us. Dr. McReynolds is a licensed psychologist and certified rehabilitation counselor with more than 30 years of experience in the field of rehabilitation counseling and psychology. She is the founder of neurofeedback clinics in Southern California, working with children and adults to reduce or eliminate conditions of ADHD, anger, anxiety, depression, chronic pain, learning problems, and trauma. She recently published the book Solving the ADHD Riddle: The Real Cause and Lasting Solutions to Your Child's Struggle to Learn. Welcome, Dr. McReynolds. Thanks so much for joining us.
Thank you so much for having me. It's a pleasure to be here today. I look forward to our conversation.
Yeah, me too. So ADHD is like such a trend right now on social media, especially. So tell us a little bit about not just what the symptoms are. I think everybody kind of knows the symptoms for that, but maybe a brief overview there. But then also, what do you find as being some of the most common underlying causes for ADHD and
Mhm.
ADD?
I think it's a great starting point because it is a hot topic. I think it's been a topic and it's just getting hotter
Yeah.
because I think more and more awareness is being really kind of put toward this difficulty that children are having, and I'll say, and adults.
Hmm.
So I've worked with children and adults, both equally affected
Hmm.
by some of the symptoms of what we call ADHD, which I think, interestingly, most people have some sense that ADHD is about the little guy who runs around and can't sit still and squirms in his chair, or
Sure.
people who can't find things or get disorganized. And those are some of the common aspects. But what I've learned is I can have 10 children walk in to my clinic on a particular day, and all 10 of them are going to have a different combination
Hmm.
of struggles that they are experiencing.
Hmm.
And within that, I think that's why some of the one size fit all kind of ideas aren't quite fitting very many.
Yeah.
It just doesn't fit well, is what really started this journey about 15 years ago,
Hmm.
was understanding the stories that parents were bringing in. It was like, we've tried all of this.
Hmm.
Nothing's had a lasting change, and we don't know what to do. Our
Sure.
child is struggling. We're struggling. The teachers are struggling.
Hmm.
That was the theme. Everyone was struggling, and there didn't appear to be a whole lot of wins that
Hmm.
were going on out there. And that's really where this all started.
Yeah, yeah, absolutely. And so as you've started to dig, what do you see as being the trend? Like it seems like this is progressing, right? There's more and more people that are having difficulty than ever before. What do
Mhm.
you think the reasons are for that? I'm sure that's a big question, but
Yes, it is a big question, but an important one, because I think there are many contributing factors.
Mhm.
One, I think our awareness certainly has improved from
Sure.
where we were 20 years ago, even 10 years ago. We
Mhm.
used to really think, well, and I think there's a lot of it. So I can't say we used to think this, because I think there's still an awful lot of it, wherein this child is just willfully misbehaving. And
Mhm.
I'm here to stay, is to say, and really, I kind of call myself a little bit of a myth buster on that.
Mhm.
If children could do better, they would, because they don't want to be in trouble. So,
Mhm.
first and foremost, and adults the same way. If your
Right.
spouse could remember the grocery list on the way home,
They would.
they would, because they don't want to catch the wrath when they walk in the door and forgot the milk.
Right.
So
Yeah, yeah.
let's just get clear. This is
Right.
not willful bad behavior on anyone's part. And that's really the starting point, I think, for some of the discussion.
Mhm.
Also, we really are, I think, unaware of what the underlying root cause is for a lot of the difficulties,
Mhm.
which is, again, back to where I started 15 years ago, as I started recognizing there's something else going on here. We call this ADHD, but it also, I'll say, it walked in the door as
Mhm.
oppositional defiant disorder.
Mhm.
That diagnosis also walked in the door as intermittent explosive disorder. It
Mhm.
walks in as trauma. It walks in as anxiety. It walks in with a long, long list of DSM-5
Mhm.
diagnostic categories. And the one thing that I have seen in common when we peel all of those labels back, and I'm not a labels person, I have
Mhm.
never been a labels person in 30 years.
Mhm.
I'm not that. And so when we peel those labels back and start to look at
Mhm.
what is really happening here, we're finding that, in fact, there's something else going on underneath all of these conditions.
Mhm.
And that is this thing called auditory and visual processing, which is why I wrote the book.
Interesting.
This is the message that I realized we need to start in order to change the narrative about people who are struggling, children who are struggling in school, adults who are struggling. This happens to people in the employment setting. I
Mhm.
can't ever remember what my boss says to me, and I'm going to get fired because he's really mad at me,
Right.
kind of thing. And I've had these are all cases that I've worked with. In cases, I mean clients and people
Sure.
who have shown up, who
Mhm.
have these tragic stories so far that just aren't working.
Right.
I think we have a preponderance of diagnosis of this in our world.
Mhm.
I'm not sure that's a bad thing, but I'm also not sure it's a good thing.
Yeah.
So I'm kind of in between on that
Okay.
because I think if it's drawing attention to the struggles that someone is having,
Mhm.
that's a good thing. If
Right.
we just say, oh, they have ADHD, there's nothing they can do about it, or I can't do
Yes.
anything to make this any better, or I'm just going to give up, it's hopeless, I can't change my life, then
Mhm.
that's not such a good thing.
Sure.
There's
Yeah.
something in between
Mhm.
there. And that's where I live is the in between phase in
Yeah.
here.
Yeah, absolutely. Okay, so there, if the issue is primarily auditory visual processing, why did that get broken? What's going on there?
I wish I could answer that because I've had children as young as 3 who
Mhm.
come in and we're finding this in them. So clearly they don't have life experiences necessarily
Mhm.
that has affected this. However, I will say that we treat a lot of children who've come through foster care,
Mhm.
some pretty rough situations. And so obviously trauma is going to have an impact
Of
on
course.
how I process information in
Mhm.
my world.
Right.
So I can be internally really distracted and my brain can be kind of hyper vigilant because of the trauma, which is going to affect my ability to really be present and take in information. So
Mhm.
we set that in the mix. We've
Mhm.
got that anxiety, depression, any
Mhm.
of those conditions. And children can have some of this as well as adults.
Mhm. Mhm.
So we really want to understand that we don't necessarily at this point know how this has happened or necessarily if something specific has contributed to it.
Mhm.
What we can say is within 20 minutes, we can figure out what it is
That
with
this
a
is happening.
computer-based
Yeah.
assessment. 20 minutes, I
Gotcha.
can find it.
Yeah. So
And
just
I find it.
to speculate a little bit, like, so what I kind of, what I think I understand as far as the neurochemistry to some degree is that there's this disconnect between, what you're going to process in the prefrontal cortex versus the limbic system where you're kind of overtaken by emotion. Is it like limbic hijacking? Is it kind of that? Is that your theory or not necessarily?
Well, I think it is for some people,
Some,
but
okay.
it isn't for all people
Sure.
because we have children and adults who haven't had any of those experiences, who
Right.
are doing okay in many areas of their life, but
Hmm.
they are not doing okay in certain areas of their life. And it becomes a real struggle for them to
Uh-huh.
be able to navigate school or work. And so it isn't just one thing, it is the possibility of many things, and the why or the how is often asked. It's like, well, how did this happen to my child? What did I do wrong? You didn't do anything wrong.
Sure. Yeah.
No one did anything wrong here in this case.
Right.
What has happened is these pathways just aren't strong enough. And I
Mhm.
equate it to I'm right handed. I cannot write left handed. If something happened to me and I had to start writing left handed, this is going to be a big struggle. This
Right.
is not my strength.
Right.
Is it possible that I could train myself to do this? Well, people have done that all over the world. People
Mhm.
have retrained their brain when they've had to.
Mhm.
This is similar. We know that training the brain has to do with repetition. So I'm going to have to practice a lot. And I might even need a coach to
Mhm.
help me figure out how I'm going to write my letters so I
Mhm.
can even sign my name legibly
Sure.
if
Yeah.
I'm trying to do it with my left hand. But it doesn't mean it's impossible, but I might have to work at it.
Right.
So I'm going to have to train my brain to
Got it.
strengthen that particular neuronal pathway in my brain to be able to accomplish this task. But once I've learned it, the good news is my brain's going to hang on to it.
Anchor it. Yeah. Yeah.
It does. It anchors it, not unlike when we have learned how to ride a bike as a child.
Mhm.
Maybe we haven't been on a bike for a number of years, but we can get back on that bike. We're typically not going to need our training wheels again.
Yeah.
We're going to be able to keep ourselves upright and not run into things, hopefully.
Mhm.
But our brain is going to remember the balancing component that's needed
Sure. Yeah.
and the physical maneuvers to move us forward
Mhm.
while we're balancing. We remember that the brain retrains it. and
Mhm.
retains it. So that's the piece. We train these areas that are weaker once we find them. And the
Mhm.
good news is with this process of brain training,
Mhm.
tends to hold.
Yeah.
So people don't need to keep coming back for this.
Right. Oh, that's great. So, one more thing before I go into the minutia of how you actually do that, simply because from
Mhm,
my world, I'm usually looking for, the global underlying cause.
mhm,
So I'm
mhm,
wondering for those people that don't have a trauma background, and you might not deal with this, and that's fine if you don't, but I'm just
mhm,
curious, to what extent have you seen an association between like gut inflammation and the neurochemistry kind of shifting? Because I've seen that a lot in
mhm,
kids with issues like this, especially
mhm,
where, the gut-brain axis connection.
mhm.
Is that something that you've seen much?
I haven't seen a lot of it,
Mhm.
but it doesn't mean it isn't there in a lot of people,
Sure.
causing difficulties.
Mhm.
And one of the aspects of the intake is I'm always asking those questions. It's like, what's your sleep?
Mhm.
What's your food routine? What are you allergic to? What foods do you not engage in? Are there, tell me the picture there
Right.
because I think it's all important.
Sure.
Parents are pretty savvy these days about food
Love that.
sensitivities.
Mhm.
And so they will say, and when the child's not in the room, or maybe even there, it's like, oh, well, we've decided our family just doesn't need to, do dairy, or we've decided the family just doesn't need to do gluten, whatever it might
Mhm.
be.
Right.
And so that's great because I know that they've been down that road. They're looking at the full picture.
Sure.
And if someone hasn't done that, then there's a conversation
Right.
about, well, do you feel sensitivities toward anything? Do you notice anything when you eat certain kinds of foods? Do you notice anything when your child, well, as you happen to mention this, I notice when he eats a box of cookies that it's like, well,
Things go a little sideways. Yeah.
things go a
Sure.
little sideways. It's like,
Yeah,
well,
yeah.
okay.
Uh-huh. No, that makes sense. So,
Um,
but it sounds like from what you're doing as far as the auditory visual retraining of the brain, you don't necessarily have to find and deal with root cause from an inflammatory systemic standpoint. It still works, even if you don't go there, right?
It really does. I mean, it
Okay.
does help when parents are really tuned in
Right,
to the whole aspect, and I do encourage that.
right.
It's like, no, if we're going to a fast food place for breakfast every morning, maybe we want to rethink,
Sure.
what other options could be available. Could you have
Right,
something at home made over the weekend? Things like that, which might help a little bit.
right.
But with the brain training, we're really dealing with tackling those areas that affect the concentration, the focus, the memory. And as we know, food can do all of that as well as medications.
Sure. Yeah.
So sometimes older folks will come in with a long list. I had this happen recently with a gentleman. He'd attached his medical records. I think he came in from the VA. And I was looking through some of the blood work. And first up, I am not a physician.
Mm-hmm.
So
Yeah.
I'm not going to make recommendations, but excuse me, they were worried about his memory. And as I was looking through some of the medications that he was taking,
Oh, yeah.
I happened to know that some of those can affect memory.
Hmm.
And so, what I will say to people is you may want to talk to your pharmacist. You may want to go on some reputable websites
Right.
to just look at, are there any ties to this?
Hmm.
Particularly if they've started medication and now they're reporting
Yeah.
some of these difficulties. It's like,
Yeah.
we may have something here. I'm not sure. It might be worth looking into, though,
Sure.
and having those conversations so that they're informed, but I'm not directing medical care.
Sure.
So,
Yeah.
mhm,
Absolutely,
mhm,
absolutely. So, tell us a little bit about how you do the audio visual retraining. This is part of neurofeedback, right?
mhm, it
Okay.
is.
So tell us,
It-
like, can you define that for our audience and then tell us how
sure.
you do it?
Sure.
Mhm.
So, a lot of people have not heard of the term neurofeedback, even though it has been around for almost 50 years now. So,
Wow.
this is not anything new in the world. This was actually developed in the 1970s at UCLA
Mhm.
by Dr. Barry Sternman. He was doing some work for NASA at the time. And
Mhm.
it has evolved. There's 50 years of research in the literature.
Mhm.
Some types of companies like to say it's still experimental.
Mhm.
Um, I'm not so sure how experimental it might still be, but
Sure.
it's similar to biofeedback. And
Okay.
so a lot of people have heard the term biofeedback. And biofeedback really began when we started understanding that if we paid attention to our mind body connection, we actually could affect how our body was functioning. So there were sensors that might have been placed on a finger to measure pulse, maybe measure respiration. It was fed into a unit where the person could see what's happening through data. And then by being coached, they could maybe be coached to relax their muscles, breathe differently, and they could see the pulse rate come down. So
Mhm,
that was the long name of that, of course, is biological information feedback.
mhm,
And for convenience, became dubbed biofeedback.
mhm,
And
mhm,
so now we fast forward a few years to neurofeedback,
mhm,
which is the same concept. We're measuring an internal process, in this case, brain waves.
mhm,
So by placing a certain type of sensor on the scalp, we
mhm,
can literally measure your brain waves.
mhm,
And with that, it's fed into the computer. There's an algorithm running the show on the
mhm,
back end. And for example, if we have a child who's very inattentive,
mhm,
what we will be doing is setting up a training plan
mhm.
that looks like these are low impact video games. So I warned the kiddos, this is not what you're used to.
Yeah, yeah, I bet.
So don't think you're coming in here running Fortnite or whatever
Yeah, I'm sure.
you might be used to. This is going to be really low impact for you. And
Yeah,
there's a reason I tell the parents later, it's like this doesn't dump dopamine into your child's brain. So,
exactly, yeah.
so by using the brainwave information, it's a one-way system. It's fed into the computer. And
Mhm,
if I can see graphs of how my brain is working, so let's say we have a green graph and a blue graph just for simplicity. We have a lot more than that. But if I'm trying to maintain a state of calmness, I'm going to be measuring some of the theta, which is a calmer brainwave. And it's like, can I make this little chart go up or down by how I'm paying attention to how my brain is operating? The
mhm,
brain will have to learn how to do this.
mhm,
So it's much the same idea as the bike. To
mhm.
learn how to ride the bike, I can tell you how to ride the bike. I can show you how to ride the bike. You
Yeah,
have to get on the bike
right.
to learn.
This helps.
And it's the same concept here. Your
Right.
brain will figure this out.
Mhm,
So the good news is the brain is really curious and it wants to figure this out. If we can just keep the thinking mind out of the way, primarily with adults,
mhm,
then we can allow the brain to learn its way through this process. And as it's learning, it's training itself.
mhm.
And so it's training itself through the repetition of the programs. And
Right,
typically it's 20 sessions.
right.
And then we're going to come back and rerun those initial assessments because that's the big marker. But
Uh-huh,
we have the markers all the way along.
uh-huh.
And as my brain gets stronger, the games, we call them,
Mhm.
are getting stronger or tougher or more advanced.
Got
So
it.
my brain is continuing to be challenged through
Mhm,
the process until we get to the kind of the area where we
mhm,
run these assessments. Then it's like, wow, your attention's really changed. Look at this. This has really gone up here, and your memory has improved. We started out at 42, it's now at 85. That's pretty
yeah,
good.
that's
hmm
awesome.
And so they get that kind of feedback as well, but they are receiving feedback all the way through in
Mhm,
their sessions and with the clinicians and the like, so that they can see. The thing with this is it's subtle.
mhm.
So there's a cautionary tale to folks and to parents. This is not the same as when you walk into a room and flip on a switch.
Sure, of course.
This is you have a dimmer switch. And
Mhm.
so you're just slowly kind of turning this up and
The light up.
strengthening till one day the light's on
Right,
and you're functioning differently.
right.
Mhm.
Yeah, that's amazing. So 20 sessions over a period of how long did you say? Typically?
Typically, there are 30 sessions
20
twice a week, and then we reassess.
Okay.
Most people need 20 hours, which is
Okay.
40 sessions,
Mhm,
but we have the midpoint there where we're reassessing
mhm,
because then there'll be a different plan created for the
mhm.
next phase of that to wire in and to catch any areas that aren't quite where we want them to be. For
Mhm,
the average person, there are some people who actually will get done within the first 10 hours.
mhm,
There are some, if we're dealing with anxiety, trauma,
mhm.
some very significant processing areas of weakness, it can take some time. Sometimes when there isn't any visual processing that we can
Mhm,
identify, or there isn't any auditory processing, so those scores are all zero
mhm,
for this child or adult, we're building
mm.
neuronal pathways in there.
Yeah.
So if we're strengthening, that's one time frame
Right.
typically. If we're
Sure.
building, then it's going to take a little bit longer
Of
because we're
course.
literally kind of starting from the baseline on that to
Right.
get the person to where they want to be.
Yeah. And does the time frame here have anything to do with, like, from the strengthening standpoint? I've heard that creating new habits is anywhere from 21 to 90 days. Does that have anything to do with the time frame that you're talking about?
It has to do with the amount of practice and repetition that's
Got
happening. And that's a bit of why that 21-day business is people get frustrated with that because they don't see the change.
that fast. Yeah.
And it's really about how often were you able to remember to practice this? Like
Hmm.
learn how to play the piano or something. I have to be at the piano
To
quite a
do
bit.
it. Sure. Yeah.
To do it. So
Right.
it's really the consistency is what I say. So
Yeah.
if someone on their own is really trying to break a bad habit, like not eating that box of cookies,
Uh-huh.
they have to do something else
Right.
to really either distract themselves or train themselves to like something better.
Hmm.
That takes time. And what will happen with these bad habits is that it does prune itself away in the brain. So that's the beauty of this is I actually have seen these clips of these neuronal connections being made. And
Hmm.
then I have seen clips of where these neuronal pathways actually disengage. And
Wow.
so this is where the brain changes in both cases. So we can affect change. And this really is grounded in the scientific knowledge of neuroplasticity,
Hmm. Yeah.
which is our brain is capable of changing all the way through our life.
Hmm.
And that's that actually came out in 1949 by Dr. Donald Hebe, who was a Canadian psychologist.
Hmm.
And it's taken a while for it to really get some,
Yeah.
footwork
Right.
in the world.
Yeah, but how encouraging that we're not just doomed to have this diagnosis forever, right?
We're
So,
not. We're not. That's why I call myself a little bit of a myth buster here.
yeah, that's wonderful. Very cool. So, and are there any other holistic approaches to ADHD, especially that you use adjunctively with this in particular?
Mhm. Well, certainly the diet and paying attention to that.
Yeah.
Monitoring the amount of video time is a big one
Mhm.
that we have a conversation
Uh,
about.
I bet. Yeah, yeah.
We've treated children who were seriously addicted to video games to the point that as the parents started to dial back, this child had gone berserk in the house and destroyed areas of the house, destroyed the father's work computer. It can get very, very serious if children are seriously addicted to these dopamine dumps
Right.
in the brain. And this actually was written about in 1999 with research
Right.
that was out about the addictive potential of these
Right.
video games. And I'm thinking that's 25 years ago. And we're
Sure.
still pushing these games out to children.
Yeah,
And
games and TikTok and like all these videos that are there that are
all
just
of
at the
this,
same
it,
time.
it trains the brain. So whenever we watch anything, we're training our brain.
Mhm.
And I think parents don't quite, and a lot of us don't quite, I didn't know until I really did a lot of research on it over the last 15 years.
Right.
Anything we watch is being recorded in the brain.
Mhm.
It's there.
Yeah.
And so, they say garbage in, garbage out.
Yeah.
And you
Sure.
have to really monitor what your brain is feasting on day to
Mhm.
day.
Yep.
And I really talk to parents about that. It's like, get outside.
Mhm.
Let's go outside. If you can, cut off the video games and go out in the backyard or go to the
Mhm.
park or do something like that where you're getting some physical activity. That's really important.
Mhm.
So, diet, exercise, sleep
Yep.
is a big piece of this, and as well as hydration. So,
Mhm.
we talk about, what are you drinking all day long
Yeah.
and some of those conversations, but as well as tips for parents and teachers for once we identify what is happening here, how do I interact with my child? The parents and the teachers will say. And so we've got strategies
Sure.
for that while the child is going through, or the adult is going through the process of strengthening those notions. So we really tackle this from many, many angles.
Mhm. Mhm. And so, given all of this, holistic approach, where do you feel like medication for ADHD fits into this, or does it?
Well, it's a very big mixed bag for me. In my book, I'm pretty clear
Yeah. Uh-huh.
because I could write my book and I could say what I needed to there. And,
Absolutely.
it's important to understand that sometimes medication can be helpful
Mhm,
what I really came to understand at the front end of all of this is that most parents who children are on medication, they've been down that road. And the folks that have shown up in my clinics, that hasn't worked well for them
mhm,
for
mhm.
whatever reason. And
Right.
it could be that there are a lot of people out there for whom this has been a blessing and
Mhm,
it's working really well for them. And I can't speak to that. I
mhm.
speak to those parents and adults who have come in. They've been down the road of variations of medications. It works for a while, it wears off, or we give the medication in the morning to get him through school or her through school. They're
Mhm.
home afterwards and just the tantrums break out, all the, because they've had to contain themselves so much at school just to try to get through the day. And then there's,
Backlash.
kind of the backlash
Mhm.
for the rest of the day and into the night or the weekends and such, or they won't give the medication over the weekend, or they take the child off of it in the summer. And
Mhm.
there are some deep concerns about some of these medications.
Yeah.
And I've been pretty clear about that in the book with all the research that's out there.
Mhm.
Everything in my book is researched and referenced, so
Mhm.
anyone can go find the original thought
Right.
and piece there if you want to really understand what's happening with these
Yeah.
meds.
Definitely on the same page with you there. So it seems like, I mean, all of these psych meds, if you didn't have a neurotransmitter imbalance before, you do now because they're
Mhm.
creating them. So that's where side
Mhm.
effects are coming from. Your body's going
Mhm.
to compensate. So, and then you eventually they'll stop working. You have to increase the
Yes.
dose. It's all of that. Absolutely, for sure.
It is all of that, and that's really what drives the addiction on the video gaming, which
Yes.
is what's so interesting is if these games are designed to do dopamine dumps, which they are,
Mhm, mhm.
then the more a child or an adult, I have dads who are struggling as much as their children are in
Yeah.
some cases. This is the brain then needing more and more of the fix of
Yep.
the dopamine. And the more that it gets from these external dumps that get created, the less the brain is going to make of its own,
Mhm,
which then starts the difficulty of when you try to come off of these games, because now there is a withdrawal process
mhm.
for this. And it's going to take the brain a while to start reproducing
Right.
the amount of dopamine that it really was capable of producing before it had these big dumps of it that
Mhm.
were artificially raising the amount of dopamine in the brain.
Yeah, absolutely. So, can you tell us maybe one or two or a couple of stories of people that have kind of had a transformation in this process?
Hmm. Love to. I always think of one young man early on. I have two of them actually, but this young man, he was a teenager.
Mhm.
And his dad called me one day knowing that I had started this clinic here in Southern California. I knew the dad. And he said his son had been in special education. He was in high school, but he had been in special ed most of his academic career.
Huh.
And that the day before, his son was sitting in the library at the high school and was really bored and decided to hack the school's computer system to change a grade.
Oh no. Wow.
So, summarily, of course, there were some very big repercussions. And then when his dad brought him in, he was a very, very angry teenage boy, very angry. We did manage to get him through the assessment. He was willing to do that. He would follow his father's instructions
Mhm.
fairly well. So there was still some respect there
Mhm.
and willingness to kind of do what the father was asking. The parents were divorced. So that was probably the saving grace, is that the father still had enough connection there to, he may have been dragging him in literally by the collar, but he did get them, he got him in the door.
Right. Yeah.
And so we assessed him, and he certainly was by no far had the biggest impact of findings, but he had some significant impacts
Mhm.
in his life where it was very difficult for him to demonstrate his extreme knowledge and
Mhm.
skill set because he couldn't perform in the ways the school was
Mhm.
traditionally assessing
Mhm.
children. So
Yeah.
he couldn't demonstrate this, and he was so angry
Yeah.
because of the failures that he had encountered. He was fighting with his peers all the time. He would get in fights on the school bus, get in
Mhm.
fights in other situations. And so we did about 20 hours of neurofeedback training with him,
Mhm.
and all of that went away. He started doing really well. He was moved to a different school,
Oh, yeah.
understandably
Yeah. I
so.
can see
And
that.
the next year, he scored the highest in the school's history on
Oh,
the state math exam.
oh, that's awesome. How cool.
And he used to joke about being the poster child for special ed.
Oh, bless his heart. That's so great. Very
Mhm.
cool.
Yes, and I was doing a presentation to one of his parents' support groups one night, and he was there, and I was having some tech problems. And I looked at him and I said, "Can you help me with this?" He said, "Well, sure, of course." Right. And
Wow.
so he was helping me with that, and I thought, I wonder. I just looked at him and I said, "Would you like to speak about your experience?" And he
Yeah.
looked at me. It didn't take him a split second.
Uh-huh.
And he said, "Yes, I would." And he literally got up there, stood next to me in front of this room full of parents, his parents on the front row.
Yeah.
And he just said, "Let me tell you what my life was like before neurofeedback." And he described being angry, being in fights all the time. And then he said a line that just sent the chills through everyone in the audience. And he said, had it not been for this intervention, he would have either killed himself or someone else.
Wow. Jeez. Wow, that's
And the room, you could hear a pin drop.
yeah.
And then he followed up and he said, "Now let me tell you what my life is like
Yeah.
after neuro."
Oh, that's so
And then
great.
he went on to say, about the state exam. So
Yeah.
that's one. I have hundreds of these stories.
Yeah.
And another one was a little girl, just as precious as she could be. And I actually had been out in the community doing a presentation to parents, and it was kind of a reading thing in the community. And it was my second presentation of the day. And I saw this little girl, little blonde haired, blue eyed, little sweet looking little girl, maybe 6 or 7. She came to the front of the room and sat at the front of the room. She was accompanied by her grandmother, who sat at the back of the room. And And so I actually was doing some demonstrations, and at those times I could use a laptop. I still have the capability of doing this. And I had a little headset that would measure brain waves, and it just sat on the forefront of the measuring brain waves from kind of the front here. And
Yeah.
I usually gave the kiddos a chance to give it a try. And they could either blow up a barrel if they could attend well, or they could float a ball if they were in a calm brain state. So I
Yeah.
had 2 or 3 of the little kiddos come through, and it was, maybe 10 minutes before I was ready to end. It was getting close to the end. And this little girl spoke up saying that she wanted to do it. I was like, oh, okay. So I hooked her up. Nothing would happen. She couldn't do anything with either one of these. She couldn't get it to go. And she was sitting there, and I gave her several minutes. And I'm thinking, oh, this is tough. I said, well, how about if we, kind of move on? No. She said, no, I know I can do this. I know I can do it. And so I thought, well, we're going to let her go here. And
Yeah.
pretty soon, she actually got enough attention going that she could blow up the barrel, and the entire room applauded. They
Aw.
all applauded her. Several months later, her grandmother showed up with her in tow, and then I got the backstory
Okay.
on this little girl. The grandmother was now a custodian. She had been abused
Oh,
in her early childhood. She had severe ADHD to the standpoint that in kindergarten, her kindergarten teacher told her she was going to quit teaching because of her.
why would you say that to a child? Oh,
So this was how this little girl presented. I'm not going into the other details that the little girl
oh,
shared with me that day, but it was one of those moments as a psychologist that it's a good thing I can have a pretty straight, not shocked face, but the
yeah.
details were significant for her. And so we started doing the neurofeedback with her. And I think we did at least 40 sessions with her, 20 hours. And the grandmother wrote to me, she wrote an email. She says, I just want you to know, because this girl would have temper tantrums. She was on medication, it would wear off. She'd come home. And the grandmother described these temper tantrums as cataclysmic events daily. So she was inconsolable when this would happen, and it could go on for quite a long time. And so they went on vacation after we kind of finished her plan. And the grandmother wrote me an email. She goes, oh my gosh. She said, I had forgotten her medication when we went on vacation. Once I discovered this, I nearly had a panic. She had a panic. She herself, she said, our vacation's going to be ruined because she's going to just have
Sure.
these meltdowns. And she said there wasn't a single meltdown the entire time. She was on no medication. Everyone had a pleasant time. And she said, do you think she needs the medication anymore? And I said, I would go have a conversation with your physician about that.
Yeah. Oh, how awesome. Very
Mhm.
cool. So
Yes.
what have I not asked you that you want to make sure you leave with our audience?
Well, I really believe that it's about understanding the neuroplasticity, which we talked a little bit about, but knowing that we have so much hope around this.
Mhm.
And that's really the message I like to talk about. I think if parents are struggling with their children, one of the key factors here is I know some parents engage in some punishment or withdrawal kind of behaviors or those types of activities with children who are, quote, misbehaving. And
Mhm.
one of the telltale signs about all of this is if those interventions are not yielding long term lasting results,
Mhm.
something isn't working. And
Mhm.
so the wrong approach isn't going to lead to the right outcome.
Yeah,
And that's the key here. The wrong diagnosis isn't going to lead to the right intervention.
right.
So you really need to know what you're dealing with. And I come from 25 years of teaching. My mother taught second grade for 32 years in the same classroom. My aunt was the dean of a college of education. Aunts and uncles were teachers and professors. So I understand the teaching world.
Yeah.
But I will say that we don't really understand what's happening here with children
Mhm.
and embarrassing children or doing anything that you think is going to motivate them from that standpoint isn't going to do it for these children.
Mhm.
If they could do better, they would be. They're not seeking punishment on a daily basis. This isn't
Of
about
course.
the adults.
Right.
This is about this child, and the behaviors
Mhm.
are a signal. Their language to be decoded.
Yeah.
And if we can get this in the right line up here, so to
Mhm.
speak. I think we're so driven to get rid of the behaviors. The
Mhm.
behaviors are telling us something. And
Right.
so if we can use this as kind of an investigation, it's like, well, what happens when I do this? What happens at school? What
Mhm.
was the instruction? How was it delivered? What was the result?
Mhm.
That may give you some insight
Mhm.
into what this is. And up on my website, I do offer a free brief assessment
Mhm.
that people can access there. You can
Mhm.
also sign up for my newsletter. You get the first 3 chapters of the book for free for that. And I promise I'm not going to pummel your email box with lots of
Uh-huh.
newsletters, but
Right.
it's a way to kind of get in the door with
Mhm.
this because in the book, I have specific chapters on auditory processing with a long checklist of
Mhm.
potential behaviors, the same with visual. And
Mhm.
then there are children who actually have both of these, and they're a combination.
Mhm.
And it's sometimes very difficult to kind of figure out what's really causing the difficulty here. But if we can understand those behaviors a little bit more, we actually have a better shot
Mhm.
at giving the right support
Yeah.
in the classroom and at home.
Yeah, that makes sense. So you kind of alluded to it, but if people want to find out more about you, your book, your clinics, where do they go?
It's all up on my website, which is www, my name, Connie, Connie, McReynolds,
Mhm.
McReynolds.com. You can sign up there. The link to the book is actually on the front page.
Mhm.
There are testimonials. There are also research articles that I've published on ADHD and on PTSD. So those are up there for those who need a snore at night.
Uh-huh. Excellent.
But there are some interesting graphs, so people might like the pictures. It
Yeah.
depends on what
Yeah.
you're drawn to. And
Mhm.
in the book, there are a lot of examples of situations where children have come in and then what we've done. And I really wrote the book for parents and teachers, but applies to all ages. So our youngest has been 3 and our oldest has been 93. And so
Awesome.
we
Oh,
tackle everyone in between.
yeah, very cool. That's great. Well, thank you so much, Dr. McReynolds. This is really inspiring. Thank you for
Well,
sharing it.
thank you so much for inviting me today. It's been a pleasure to be here.